Hi, my name is Dominique Carnot. I'm doing my presentation for Nursing 621 Advanced Nursing Practice at UHeart. This is the MSM track, and Dr. Karen Dumahel is my professor for this particular class. My presentation will be on effective suicide screening and assessment in the emergency department, and I will use the particular bill I found and relevant recent research to talk about how there can be improvements made to those particular areas of healthcare. My learning objectives for this presentation are going to be to familiarize my audience with effective suicide screening and assessment in the Emergency Department Act of 2021. So this is the bill that I will be using for my presentation. I'm going to discuss how supporting research identifies a need for improvement of these services. And I'm going to use supporting research to understand how these services could be implemented in healthcare systems and convey that to my audience. So the particular bill I'm using for this presentation is called Effective Suicide Screening and Assessment in the Emergency Department Act of 2021. This particular bill was introduced by U.S. Senators Angus King and Lisa Murkowski. This bill was introduced in May of 2021 and passed in the House, particularly on May 13th, 2021. Some of the pros and cons about this particular bill. One of the pros I would say is that it's bipartisan legislation, which means it does have support from both Republicans and Democrats, which is nice to see that both groups can come together on a particular topic and agree and try to make some improvements. And I do feel like it is a stronger bill and we'll get a little bit farther with both parties' support. It does have support, like I said, from bipartisan leadership as well as mental health support organizations all around the world that have definitely put out a lot of supportive documents in regards to this bill, urging for it to go farther in this legislative process. One of the cons of this particular act, I would say, is that it is a little bit selective, which we will talk about later in the presentation, but overall I do think it is a good bill and do think there's a lot of pros to it. So what does this bill suggest? This bill does identify suicide as a leading cause of death in the U.S. Suicide is the 10th leading cause of death in the U.S. per the information from this bill, as well as supporting research, so that definitely defines a need for services in these areas. Targets suicide as an expected growing issue post-COVID-19 pandemic. We all know a lot of people have been stuck in the house, definitely having a hard time socially, mentally. So that is definitely expected to grow with those suicide risk factors and numbers in the coming years. The bill finds emergency departments of hospitals to be a destination for distressed patients looking for mental health care. They're finding that a lot of people are coming in through the emergency department for crisis kind of help for mental health problems, especially suicide. So there definitely was a need in that regard. And it pinpoints emergency departments and hospitals as in need of improvement to mental health services. This is especially in particular to access and follow-up care. This bill identifies the need for better suicide screening, assessment tools, resources, and support staff. So all of the different components that really will beef up a mental health support service system in healthcare facilities. The details of this particular bill are that $20 million in federally funded grants are going to be allotted under this particular bill. These federally funded grants are going to be awarded to 40 eligible hospitals that are selected. This does apply to the fiscal period of 2022 through 2026. Some of the eligibility criteria are that hospitals have to have an emergency department, they must provide mental health support services, and some of the preferences for awarding the federally funded grants are going to be demographic areas that have higher suicide rates than the national average, also showing preference to Indian tribal organizations in regards to the hospitals they choose. So in regards to potential cons of this bill, I did see that as, the bill being a little bit selective, just because the preferences might mean that a lot of similar kinds of facilities are being awarded these grants. To track progress, there will need to be annual reports submitted with all the details of how many patients are being treated, what the health outcomes are, all the statistics of the data collected with these changes that were made at these hospitals using the federally funded grants. So there's a lot of supporting research on suicide risk screening in healthcare settings, especially primary care and the emergency department. The particular scholarly article I chose to use to support this bill was Suicide Risk Screening in Healthcare Settings, Identifying Females and Males at Risk. This was a 2017 article, and it really had a lot of great information to support the need for reform in mental health services, especially suicide risk screening. It did support the fact that the suicide issue in the US is the 10th leading cause of death among people here, so definitely did identify a large need to have some reform to this particular area. It did mention that suicide rates are on the rise since 2015 and continue to just get higher and higher, so it is a more prevalent issue as we continue on. There are expected increases due to the social media culture and COVID-19 pandemic in regards to the suicide rate, especially among younger people in the coming years. In 2014, there were 42,000 US suicide deaths, which is unfortunate, and definitely looking for a way to add some reform to minimize that number. The supporting research did go into depth quite a bit about the differences between males and females, their likelihood to express depression, suicide ideation, thoughts of it, just the symptoms, the means they take to go about and use that, the services they seek. So this article was really helpful in identifying the different behavioral patterns as a way to help screen people for suicide risk. Males are definitely more prone to suicide than females are. It is the 7th leading cause of death among males. And one of the interesting things that the research did find was that as far as primary care and ED visits for these patients who unfortunately did end up committing suicide, there's a decent number, about 30% of people in a Canadian study that was found, that do visit either primary care or the ED seeking help within a month of suicide. So definitely makes a good point that healthcare settings are a good way to intervene and get people the help they need. So one of the big tools that this particular scholarly article introduced and talked about the benefits of was the ED Safe tool. This had really good results, really strong tool to use. And so this is one of those tools that I think could be implemented under this bill, or tools that are similar to this, to be able to help improve the suicide screening in the emergency departments. So this tool was implemented in 8 general medicine EDs in the US. It showed increases in detection of suicide risk by 2-fold, so definitely did have significant benefits. It did include screening for self-harm and suicide ideation. It included a universal screening portion, a patient safety screening, did include an intervention phase that was patient-centered and customized to the individual needs of the patient and what was going on with them. And it did include a phone call follow-up with contact information to mental health support services and personnel. Surveys of providers utilizing the tool demonstrated feasibility of implementation, so a lot of providers thought that it was very user-friendly, easy to implement, and would not stifle the workflow that they already had established in the ED, which is important as a healthcare personnel. Surveys also showed among healthcare providers utilizing the tool that there's improved awareness, understanding, and attitude about suicide screening, which is really important because part of people's hesitancy to report suicide risk ideation is the stigma attached. So this is definitely really important that healthcare personnel are more well equipped to be doing these screenings and paying attention. A really big important part of the research that did support the need for the suicide screening and the suicide care was follow-up care implementation. So these are some ideas that I found from the article that have had good results previously that would be good tools to implement in regards to this bill potentially being, finalized. So it was really important to facilitate follow-up with mental health professionals. This definitely reduces risk of suicide, self-harm, readmission. So really setting up that follow-up and giving that patient an outlet to be able to go to if they have any concerns or thoughts of hurting themselves is definitely really important and showed really good results. Giving people crisis contact information. There is like a suicide hotline. There are resources that social workers, mental health professionals do give patients who have suicide risk and ideation. So it's definitely important and showed great results to be able to give these to patients before leaving the hospital. Setting patients up with coping strategies, helping them find ways to cope when they're feeling stressed, overwhelmed, depressed, and helping them come up with that custom list of things that they can do to kind of help them when they're in a difficult spot. And also definitely safety sort of concerns. So reducing access to lethal means was really important, especially in regards to males. Males have been proven to show more use of lethal means to commit suicide and therefore usually are more successful. So coming up with a safety plan, safety screening, and making sure that there are no lethal means or at least less access to in the home if we know that someone is suicidal. Overall, some of the key points of this bill research and overall presentation is that suicide is a major public health issue in the US. There's much room for reform in mental health services, and I know we are making strides already, but we definitely need to keep pushing to make more improvements. The ED is a worthwhile place to target for improvement of these services. Many of these patients are coming into the ED for crisis help, so this is definitely where we can intervene and set them up with resources, and it's a good place to do that. Utilizing current research will provide guidance to implement the most effective changes to mental health services in hospitals, a lot of these federal grants. So we definitely need to use current research like I presented in this presentation, but also any other available current research. We need to keep up with best practices, and it's definitely going to help us, use multifactorial tools and policies and protocols to be able to, provide the best mental health services we can. And expanding access to mental health services and follow-up care, in conclusion, will reduce suicide rates in the US. So I think just improving, the amount of mental health staff, workers, resources, hotlines, therapists that people have access to, all of that will really help to combat the suicide crisis that unfortunately is going on and will help to reduce those rates in the US. These are my references. Overall, I thought this bill was really relevant and important. I did think that hopefully it will go far, and it does have a lot of importance in the healthcare setting and healthcare climate nowadays, especially with the COVID-19 pandemic. I do think this will become a worsening issue. So I definitely support this bill and think it's really important. And hopefully after this presentation, you do too. Thank you for listening, and that's about it.